Is this an intended object within the pulmonary artery? We see an approximately 2 centimeter metallic structure with a linear shape in a left lower lobe pulmonary artery. This is how it looks in the sagittal plane. This is a CardioMEMS device. What is that? This device is indicated for wirelessly measuring and monitoring pulmonary artery pressure and heart rate in heart failure patients who have been hospitalized for heart failure. Using a percutaneous approach, the sensor is implanted in the pulmonary artery. It's typically in the left lower lobe, but it can be implanted in the right lower pulmonary arteries, as seen here. Once the device is implanted, daily pressure readings are obtained with external electronics unit and wirelessly transmitted to the doctor for continuous monitoring. Note the large nitinol loops on either end of the sensor that secure it into the branch pulmonary artery by their outward force. This is sometimes evident on CT. On chest X-ray, it's not typically seen. Previous studies have shown that clinical signs and symptoms of heart failure, as well as lab values, including BNP, are poor at recognizing early signs of heart failure. The effectiveness of this device was evaluated with a landmark CHAMPION study in 2011, which demonstrated that pulmonary artery pressure-based therapy reduces hospitalizations and mortality. While the CardioMEMS device is FDA approved for use in heart failure, studies have also shown the utility of hemodynamic monitoring in patients with aortic aneurysms after endovascular aortic repair, EVAR. This device is considered investigational with prior EVAR, but prelim studies have demonstrated utility in early detection of type 1 and type 2 endoleaks. The imaging features of this device in patients with aortic aneurysms are similar to those in patients with heart failure. However, the sensor is inserted within the aneurysmal sac adjacent to the stent graft. As with the device in heart failure, complications are typically related to device placement or device migration. In terms of the differential, consider other unintended foreign bodies. For example, consider dislodged or fragmented pacemaker or catheter leads. Also consider cement pulmonary emboli from vertebroplasties. The main difference again is the large nitinol loops on either end of the sensor that secure it into the branch pulmonary artery by their outward force. You now know a lot about the CardioMEMS device. Please subscribe for more awesome anatomy and radiology videos.